Multiple studies have demonstrated that reproduction in animals shortens lifespan in the majority of cases. However, some researchers were surprised that there have been no thorough studies on specific causes of mortality in association with reproductive capability and sterilization status, resulting in little understanding of this relationship. I'm presenting Hoffman, Creevy and Promislow's research titled Reproductive Capability is Associated with Lifespan and Cause of Death in Companion Dogs. They hypothesized that inconsistencies in results have been due to studies considering when individuals die rather than why they die. Canis lupus familiaris, the domestic dog, was chosen for this study, as it displays a wide variety of breed-associated characteristics, not only related to morphology and behavior, but also in cause of mortality. In North America, elective surgical sterilization of domestic dogs is so common that it has inadvertently provided a large-scale experiment on the consequences of eliminating reproductive capability. This study covered longevity as well as pathophysiological causes of death, since previous studies have not considered that diseases that occur later in life will be more common if elective surgical sterilization allows the individual to live longer. The VMDB, which collects medical records from American veterinary hospitals, was used in cause of death analysis, comparing 40,000 purebred domestic dogs that died in veterinary teaching hospitals between 1984 and 2004. Records were examined and categorized according to breed, age and sex, whether they were sterilized or intact, and the pathophysiological process resulting in death. Results showed that sterilization has a significant effect in the survival of both sexes, with an increase in life expectancy of about 14% in males and 26% in females. It was found that sterilization dramatically decreases likelihood of death due to trauma, infectious, vascular, and degenerative diseases. However, death from neoplasia and immune-mediated disease is more common, even when considering specific age groups. Because of the human relevance, neoplasia and infectious diseases were further analyzed. The majority of the cancers analyzed are the same as those most diagnosed in humans in the US. There was a high frequency of these cancers in sterilized dogs, with the exception of mammary cancer, which occurred significantly less. Conversely, the infectious diseases considered had much lower frequencies. Mortality rates were consistent when comparing small to large breeds, and though death due to neoplasia is relatively rare in small breeds, the risk is still increased. This study proved that lifespan is greater in sterilized dogs, and that some causes of death are less frequent in intact dogs, but the relationship between reproduction and cause of death is likely to be far more complex. Factors such as hormones, growth patterns and development, age sterilized, related behavioral differences, and socioeconomic status could be the focus of more specific studies. Researchers concluded that scrutinizing pathophysiological consequences of sterilization and lifespan will greatly increase the understanding of the impact of reproductive capability on mortality. Domestic dogs are an established medical model for humans, as no other animal so closely mirrors human experiences. And so this research could assist in explaining contradictory findings in human studies.